Hi, my name's Amanda, and I'm going to be your nurse today. I'm going to wash my hands, then I'm going to sanitize. I'm going to close the curtain and shut the door and give my patient privacy. We're here for peripheral or vascular assessment. Can I please start with your name and date of birth?
Lawrence Lewis, 92703.
And can I check your bracelet? Thank you, Mr. Lewis. Do you have any questions or concerns for me today?
No.
Okay, I have a few questions for you. Have you or has anyone in your family or had any history of diabetes,
No.
varicose veins,
No.
any cardiovascular disease,
No.
any neuropathy disorders or issues?
No.
Okay, now just for you. Do you get any headaches?
No.
Do you have any jobs or hobbies that cause you repetitive lifting, over excessive bending?
No.
Anything that could give you any injuries?
No.
Do you have any numbness, coldness, or tingling in your arms, hands, fingers, toes, legs, or feet?
No.
Do you ever get any cramping in any areas?
No.
No numbness or tingling at all?
No.
Do you smoke?
No.
Have you done illicit drug use?
No.
Does anything bother your normal daily routines?
No.
Okay, I'm going to go ahead and begin your assessment. In inspection, I see that the long bones and arms are proportionate and symmetrical. There's no signs of atrophy or hyperatrophy. There's no osmosis, lesions, or edema present. The skin temp is warm. The skin is smooth, pink, and moist. The turgor is intact. Patient is not dehydrated. Can I please see your nails? Patient's nails are smooth and pink with a brisk capillary refill and a brisk capillary refill on the other side as well. Patient's skin color is appropriate for ethnicity. Now on to the lower extremities. On the legs, the long bones and the legs are proportional and symmetrical. There's no signs of atrophy or hyperatrophy. The skin color is appropriate for ethnicity. The temp of the skin is warm. The skin is smooth, moist, and pink and appropriate for the ethnicity color. On his nails are smooth and pink with a brisk capillary refill. And on this side, brisk capillary refill, smooth and pink nails as well. No signs of ecchymosis, lesions, or edema. No signs of clubbing on the toenails. And sir, could you please go like this with your two fingers? And no signs of clubbing on the fingernails as well. Now I'm going to go ahead and take his pulses. We're going to start with the right carotid artery. And that pulse is a +3. Left carotid artery. And that pulse is a +3 as well. Now we're going to move to the right brachial pulse, which is on the medial side above the antecubital, where we listen for the blood pressure. And that is a nice +3. Now we're going to move to the left brachial pulse, right above the antecubital, medial side. And that is a +3. Now we're going to go to the right radial pulse. This is on the lateral side of the wrist by the thumb. And that is a +3. Now we're going to go to the left radial pulse. This is on the lateral side by the thumb by the wrist as well. And that is also a +3. Next, I would go into the femoral artery, which is deep into the groin and the medial sides. I'm not going to take either one of those, left nor right. And now I'm going to go to the right popliteal pulse, which is right behind the kneecap. I'm going to put my fingers behind your kneecap, sir. Just let your leg relax, and I'm going to push up so I can feel that pulse. Just let your leg dangle there. And that popliteal pulse is a +3. Now I'm going to move to the left popliteal. Same thing, sir. Under the kneecap. And that one's a +3 as well. Next, we're going to move to the posterior tibial pulse. This is on the medial side by the ankle, by the Achilles tendon. And we're going to start with the right foot. That pulse is a +3. And now we're going to go to the left posterior tibial pulse, which is on the medial side by the Achilles tendon and ankle as well. And that's a +3. Now we're going to go to the left dorsalis pedis. This is by the big toe and the long toe and middle toe. We're going to run right up here on the medial side. And that's a +3. And now the right side, dorsalis pedis. Again, we're going to run along the long toe, or the big toe, long toe, and middle toe on the medial side. And that is also a +3. Any concerns for me, young man? Okay, I'm going to have you grip my fingers. +3. Okay, can you please pull my arms? +3. Can you push them? +3. Okay. Can you pull back on my hands? +3. Can you push on my hands? +3. Okay. And can I please have you stand up? Take a few steps forward, turn around and walk back. Gait is smooth and steady. He's not unbalanced. And please sit down. Did you feel dizzy at all?
No.
Any numbness, tingling, pain?
No.
Okay, patient strength bilaterally, upper and lower extremities are +3. Gait was smooth and steady. Okay, so that's it for your peripheral vascular assessment. I'll see you again. Thank you.